Hello, nice to see you both today.
Hi, thank you for having us.
Of course, so could you guys introduce yourselves, just your name, your title, and then a short bio about yourselves, and then your credentials, and then after that, the title of your article.
Sure. My name is Aliza Narva. I am the Director of Ethics here at the Hospital of the University of Pennsylvania. I am trained as a nurse and as an attorney. And I spend most of my time doing clinical ethics, run the ethics committee and the ethics consultation group, and I get to work with Erin all the time.
Hi, everybody. My name is Erin Marturano. I'm the ethics manager at Hospital of the University of Pennsylvania. I'm a member of the ethics committee and the ethics consultation service, and I also manage a lot of the clinical ethics programming that we have at the hospital. And my background is in oncology nursing, and then I went and did a dual master's program in bioethics and nursing health leadership before starting this role as the ethics manager.
Amazing. Well, it's great to meet both of you. I was just wondering if you could briefly give us an overview of why nurses should read your article.
Sure. Um, I think that our feeling is that ethics really undergirds everything that nurses do every day. And so the more ethics support that nurses can have and the more ethical knowledge nurses can have, the better they're going to be able to enjoy their jobs and also to take care of their patients. We're really proud of the work that we've done here because, obviously we're only two people. We're a limited resource, but we both feel that if we can build ethics infrastructure and build the visibility and availability of ethics resources, we're going to be able to help more nurses, and that means we're going to be able to help more patients.
Yeah, we've also found that nurses, among other clinicians, are really eager to get more ethics education. So embedding nursing ethics into already existing structures was sort of a slam dunk. So that we weren't, reinventing the wheel. We were able to use the awesome resources that we already have to embed nursing ethics right at the bedside for everybody to use in their everyday practice.
Amazing. So I know nursing ethics is obviously a very important topic to talk about. So what made you specifically want to write an article on nursing ethics?
I think ethical decision making is really within all of our scope of practice, but it's not something that we necessarily that we just innately have, right? So it's within our scope, and we have ethical obligations. For instance, we have the American Nurses Association Code of Ethics for Nurses, but it's not something that we just learn overnight. It's something that's learned, it takes practice, it's multi-layered, and we know that these are skills that many nurses don't formally get. And so we really wanted to develop programming that supports staff in achieving these skills. And we were fortunate enough to have the leadership support and a robust shared governance model to embed this in for a smoother transition. And as Aliza said, we're so proud of the work that our mentors and our colleagues and staff have put into the ethics programming here. And so we really just wanted to share our best practices and what we've learned along the way with this program, and hopefully keep up the momentum in nursing ethics space.
Exactly. And the way that we think about ethics is everything relies on ethics. Ethics isn't some special interest on the side. Ethics is underneath everything. It's why we do what we do. That's why the Code of Ethics is so helpful. It tells us what our obligations are to patients. It helps other people know how we should respond in specific situations, what we aspire to do, and how we aspire to do it. And so our feeling was this is actually just support for folks who are in the clinical environment, especially right now. We're in such an unusual time. We have so many new to practice folks who are really looking for guidance for, how do I practice? What are my obligations to myself? What are my obligations to my patients? How do I navigate healthcare at this really unusual time?
Yeah, so with ethics being as important as you guys are describing it to be in the nursing world, what are 2 to 3 things you'd like nurses to take away from this article?
I'll take a shot at that and then I'll pass to you, Erin. I think, first of all, that building ethics infrastructure is doable, right? It's not hard. It takes a little bit of elbow grease. It takes, making the argument for why it's vital, but it's not something that's especially expensive, right? Like, we used resources that we already had, and there was a tremendous amount of interest in this. Nurses are interested in ethics. They want ethics support, and we actually know that ethics education and ethics support mitigate moral distress, right? So it makes sense to do this. We also felt, well, Erin, I'll let you jump in.
Sure. Yeah, I mean, I second everything that Aliza said. We have the resources, and so it's really just pulling from all of those amazing resources we have, and then kind of polling our staff. Like we found that there were a lot of people interested. We were so fortunate. We had a lot of interest when we first rolled this out. And I think one takeaway also is getting a diverse council. So, we want to maximize the impact. Our organization is pretty large, so getting folks from different practice areas, different experience levels, that was really imperative in just, keeping up the day-to-day work of nursing ethics.
I think what we want folks to take away is curiosity. We want them to feel like they can leave a meeting, or they can leave a session that we've had with some new insight into how to be curious about clinical practice, and how to be curious about their multidisciplinary colleagues, how to be a little bit gentler with themselves, or a little bit more curious about, like, why am I responding this way in a clinical situation, and able to engage a little bit more in thoughtful communication. I think that, there's a lot of tenseness, there's a lot of pressure in the clinical setting, and so if folks can come away with just a little more ability to be kind to themselves and their colleagues and their patients, that's going to make clinical practice better for everyone.
Awesome. Is there any other information that you guys want to put out there?
I mean, we don't want to give too much away. We want people to read the article.
Of course.
Yeah. I don't know. Do you have anything else, Aliza?
No, I mean, nursing ethics is ethics, right? Nursing ethics is bioethics. It's all the same stuff. And I think it's just remembering that, it's okay to take a second and think about why you're doing something. It's okay to respectfully question a clinical decision making, make a decision made by someone else in your setting. And it's okay to slow down for a second to make sure that you're doing the right thing. And I think having ethics in shared governance is something that really reinforces that, and that's important.
Awesome. Well, I thank you both for taking time to sit down and talk with us about this today. We really appreciate it, and good luck to you and everything you guys are doing.
Thanks so much, Andrew.